Jennifer Mathieu is the Territory Manager for Canadian Blood Services, overseeing Durham Region, Northumberland, and Scarborough. Jennifer worked in retail management for over 20 years before joining CBS. After her husband was diagnosed with cancer and needed dozens of blood transfusions to stay alive, she decided she needed to make a major change in her life. She wanted a career that made her feel as though she was making an important contribution to society, and that what she did mattered.
After the miraculous birth of a baby boy, she joined the CBS family. She not only feels as though she's able to make a positive contribution to society and the lives of people in her community, but she feels she can give back to those that gave a bit of themselves so her husband could live and become a father. So welcome, Jen. Thank you for doing this. Yeah, you can share your screen.
Perfect. Okay, so thank you everybody for joining me today. I am, as mentioned, Jennifer Mathieu from Canadian Blood Services. That's me. And as he mentioned, I am the Territory Manager. And with me today is Amy Chatta. So just to give you a little bit of information about our roles, we work together to ensure that we have enough venues across all of our territory in order to meet hospital demand in our area. And on the flip side, we're also responsible to ensure that we have enough donors donating at those events so that we meet those targets. So today's presentation will primarily talk about why the need for blood is so great, and as well how we've adopted during COVID. And I'm also going to talk a little bit about how you may be able to help us spread the word about the need for blood. I'm going to be covering a lot of information, and I'm actually going to have some quiz type questions. So I would love some participation. So if you wanted to unmute, please feel free to do so. Don't be shy. They're not too hard, and I won't grade anybody at the end. So let's get started. So Canadian Blood Services was founded in 1998 based on recommendations from the Creever Report following the tainted blood tragedy. At Canadian Blood Services, we're dedicated to improving patient outcomes through the manufacturing and delivery of safe, relevant, quality products and services to all Canadians. Volunteers, partnered organizations, community groups, and generous donors and employees really do work together to make our work possible. So we're the connection between the sincere generosity of donors and the heartfelt appreciation of recipients. Donated plasma touches the lives and families of thousands of patients who require life-saving therapies and treatments made from plasma-derived protein products. Stem cells, or specifically blood stem cells, are immature cells that can develop into any cell present in the bloodstream. We also work with organ and tissue and transplantation community to develop leading practices, professional education, public awareness, and data analysis reporting. And the primary focus of today's conversation are management of the national supply of blood products for provinces and territories excluding Quebec. So I would like to introduce you to Percy. Percy's a convalescent plasma donor, and he told us, "I felt I needed to help in any way I could. I read that donating plasma may be a benefit to COVID-19 patients, which led me here." Canadian Blood Services is proud to be part of a national clinical trial to test if COVID-19 convalescent plasma, which is plasma donated by people who've recovered from COVID-19, could be a safe and effective treatment option for patients with the virus. So let's spend just a few moments talking about COVID. Canadian Blood Services is responsible for the safety of the national blood supply system, excluding Quebec. And I just wanted to note that we are actually considered one of the safest blood systems in the world. And during this difficult time, it's crucial that we continue to deliver on that promise. Safety is our highest priority, and so enhanced wellness measures are in effect throughout all of our donor centers. We're conducting wellness screening at our entrances, where we'll ask questions about travel and about symptoms that you might be experiencing. There will also be a question and possible COVID-19 contact or public health investigation question, and anyone who wants to come into our site must have their temperature taken. We've made some changes within our facilities as well. We've implemented enhanced cleaning requirements. We've installed protective plexiglass barriers where needed, and we have fewer seats in our refreshment area as well as everywhere else. We've also made some changes to how snacks and drinks work. Don't worry, we are still providing all the snacks that everybody loves, but we're no longer providing them pre-donation. So we do encourage people who want to come, who are coming in, make sure you drink and eat before you visit the donor center. And then after your donation, you can enjoy your post-donation snack after you've left our building, because we require everyone to wear masks throughout the entire time. We are also limiting the number of people in our sites. All donors have to have an appointment now. We're no longer accepting walk-ins, and we do require physical distancing where possible. Physical distancing measures in our donor centers put new constraints on how much blood we can actually collect. These measures protect both employees and donors, but that means that there's fewer donors at the donor centers, and that also means fewer life-saving donations for the patients. Let's take a moment and explore that a bit. The need is constant. Despite what's happening in the world, it doesn't go away. So, a few questions for you. How often does someone in Canada need blood? So anybody just unmute yourself, shout out an answer. Let's see what you think.
I go every 30.
30 seconds.
Every 30 seconds, okay.
Yep.
So the answer is actually every 60 seconds. So every 60 seconds, there's someone in Canada undergoing a blood transfusion. So another one, what do you think? For those that actually can donate blood, what percentage do you think actually do? Do you think it's 14, 4, or 24?
14.
Okay.
4.
So it's actually fewer than 4% of those who can donate actually do. So that's a very small percentage of people that are currently sustaining the blood system, which will affect half of all Canadians. Okay, one more. How long do you think donated blood lasts?
14 days. Yeah, well, they got 31 days here.
I said 31 days.
So the answer is 42 days. So it does have an expiration date, but just so you know, plasma, which is a very important part of blood, only lasts for 7 days.
Oh, plasma 7.
So I've shown you that the need is constant, but the need for blood donors rises during the summer months, during the holiday months, and also on long weekends. Donors with all blood types are always needed. We always have people say, what type of blood do you need? We always need all blood types. However, donors that have O-negative blood are always in demand.
David, isn't
it? O-negative, yes.
O-negative.
Yes, so their blood can be used for all recipients. Their blood is so valuable. Sorry. Their blood is so valuable that when there's an emergency situation where time is literally clicking or ticking, and there's no time to check that person's blood, we know that we can give them O-negative blood to help them survive.
I'm just listening.
So we need over 112,000 new donors every year. So our organization and the donors we rely on provide new chances at life. However, we actually receive about 1 million donations every year. Let's run through some of the ways that blood donation helps save lives every day. So somebody undergoing cancer treatment could potentially need up to 5 donors to save their life. How many donors do you think it might need, somebody with leukemia might need?
More than that.
More than that, yep. So it's 8 donors, but that's 8 donors each and every week.
Oh, wow.
Yeah, so we always hear about little kids going through leukemia, and it's just so heartbreaking. Imagine a 3-year-old having to be hooked up to a needle and receiving potentially 8 blood transfusions each and every week. Somebody undergoing brain surgery could potentially need 2 donors. Somebody with a blood disorder, potentially 4 donors a month. This next one is the one that really gets me, a car crash victim. So who has a guess? How many donors do you think it could potentially be needed to save somebody in a car crash? Dave, what do you think?
I think Frank is the one that was in a car crash.
Oh, really?
Jenn?
So this one here really gets me. So it's potentially up to 50 donors. Now, that doesn't mean that everybody that's been in a car crash needs 50 donations. However, I was working in a donor center with a group one day, and I was telling this statistic to one of the champions, and someone tapped me on the shoulder, and I turned around, and it was a young woman, and she said to me, she overheard the conversation, and she wanted to let us know that she had been recently in a car crash and needed exactly 50 donors to save her life. So imagine all the people, think about all the people you know. Like, do you know, is that enough people potentially to save that one person's life? It's a crazy example. Another really great example of how much blood we need and why it's needed so often.
Surgery.
Yeah, heart surgery. You know, how many people do we know that eventually potentially could have heart surgery? Like the need is constant, and there's so many different reasons. So we've seen the need, and we've talked about how each donation helps. Let's move on to who can help. So we're going to go through some basic high-level eligibility. There's obviously a lot more to this, and just so you know, final determination of eligibility does happen at the donor center. So to be able to donate, you must not have gotten a tattoo or piercing in the last 3 months. You must not have been pregnant or had a baby in the last 6 months. You have to be at least over 17 years of age. We no longer have a top age limit.
Oh,
Yeah, so that changed about 3 years ago.
oh, I didn't know that.
We just want to ensure that you're in general good health, and if there are concerns or there's a lot of medications you're taking, you know, we all ask that you call our 1-888 number to speak to an information nurse. And then you must not have lived in certain countries during certain times. So the list includes the UK, France, and Saudi Arabia between 1980 and 1996. And Western Europe between 1980 and 2007. And for those of you that don't know the reason why, unfortunately, it is because of mad cow disease. So there currently isn't any test available in the world to be able to remove this eligibility criteria.
Jenn, how about oh, you're still going on. Okay, go ahead.
Jennifer, when you said not resided in the UK, does that, or let me rephrase it, would that include having been on holiday there, like for 3, 4, 5 weeks or not?
No, I don't think so, but I can double check for you.
Okay.
Sorry, Jen, I missed the reason why.
It has to do with mad cow disease.
Okay.
So unfortunately, the chance of, you having it or anybody is very, very slim. However, it is not something that is testable at this time. So there is a worldwide ban on it. And then for those in certain countries like Saudi Arabia, it has to do with the importation of beef products during that time. And from what I understand, somebody informed me that because of West Nile virus being so prevalent in Canada, if I were to move to the UK, I wouldn't be able to donate blood. Now, that I don't know that is a fact, but it was just something that was explained to me. So again, the chance of me having West Nile is probably slim to none, but it's just one of those things, unfortunately, that is on our list of eligibility, and another reason why our blood is one of the safest in the world. So just to continue on, you have to weigh at least 110 pounds. You can't have had a cleaning or filling in the last 24 hours or dental surgery in the last 72 hours. We do, in a non-COVID world, a lot of us like to travel, so there are travel restrictions as well. And there are obviously medication restrictions. However, on our website at blood.ca, you can find a list of the 40 most commonly prescribed medications that still make it okay for you to donate. You could also call our 1-888 number to get more information. So before you donate, as I mentioned, sorry, go ahead.
Can I ask a question? Sorry. So can I donate blood? I'm a pilot.
Apparently there are restrictions to pilots. They don't want you to donate.
Yeah, that's right. That used to be in the years past, and I was just wondering if it has changed. Yeah.
I was speaking with a pilot recently, and he was donating, and I think he's stopped. He's no longer in that career, so he has started donating. But he told me that they actually would recommend that you don't donate blood while you are actually, doing that.
Yeah, that's what I heard too. Yeah.
Gert, is that because of your tattoos?
I only have a tattoo of my mom. No, I don't have any tattoos. No, it has to do with oxygen saturation in the blood and stuff like that. It's very important that you wear oxygen mask of a certain height, blah blah blah, this and that. That's what it's about.
You don't black out while you're up there.
Yeah, exactly.
Excellent question. So as I mentioned before, you do need to book an appointment right now during COVID. You have to bring photo ID. If you're a regular donor, your donor card would be sufficient. We do encourage you to eat a salty snack before you donate and drink a lot of water. Why salt, you wonder? So this is the one time where salt's actually really, really good for you because it does, because it does allow your body to retain a lot of fluid. We will be removing a lot of fluid from you when you donate. So it actually is a really good thing for you to do. So we do encourage salty snacks before and after you donate. At the donor center, you will have a wellness check, as I mentioned, which will cover COVID-19. We do require that you wear a mask. You are welcome to wear your own, but we do have some in the donor center for you. You'll check in. We'll have a pamphlet for you to read. You'll complete a donor questionnaire as well as have a one-on-one interview with a nurse. And then you're going to sit back, relax, and donate on one of our comfy chairs. We're now providing pressure bandages instead of Band-Aids to the arm. We will encourage you to do muscle tensing exercises, and this is actually encouraged to speed up recovery and make sure you feel better faster. We want you to stay for at least 5 minutes in a physically distanced area. And then you will grab your drink and all those wonderful snacks after you've left the building. So as I mentioned, we do need over 112,000 brand new donors each and every year. So here's where you and your organization can help. So, you can book an appointment. It's as easy as that. You can do it online at blood.ca. You can call us at 1-888-2-DONATE. Once you're online, you just hit book now. The registration process is so easy, and then we'll send you an email confirmation.
Is that your kidneys are in, that you want to listen to them.
Peter, you should maybe mute your phone.
Oh yeah.
Thank you.
If your organization has a champion or a group booker, they might have sign-up sheets for you, or we have an app. It's called Give Blood, and you can download that and book your appointment just as easy. Another meaningful way you can help Canadian patients is to help us to recruit donors for blood donation. You want to start with a conversation. Authentic, engaging conversation is really the key. You could talk about the great presentation you heard today, some of the statistics that you learned, and then encourage people to check out their eligibility online. If you are interested in helping us promote within an organization or a church or a community group, we can provide you with posters, we can provide you with social media toolkits, where it's just with a few simple clicks, you can help promote the need for blood on your social. If you're donating yourself, don't forget to take photos of yourself, share them to your own social media, share them with friends and family, and this is what you're showing everyone the amazing way that you're helping to save lives. Helping to raise awareness has a more significant impact than you might think. Here are just 4 examples of individuals who use the power of their social media to highlight the need for blood. So the first young woman was feeling helpless during our COVID-19 situation and found that something important in both donating and sharing. The second post is in support of a blood donor campaign that this man supports. He's added a request that those who see his post donate too. The third one is a couple of sisters donating and loving what they call sweet red ninja masks. And finally, a dancer who isn't able to donate while he's normally performing is now taking this time with COVID to donate and to spread the word. So there's some really great questions that we get asked all the time. So I'm just going to run through them with you. People often ask, how long does a blood donation take? So the actual blood donation when you're on the bed with the needle takes only about 5 to 10 minutes. But we tell people to plan to be in the donor center for about an hour for things like screening, eligibility, and then your post-donation recovery. Another one people want to know is how much blood do we take? So we take approximately 450 ml or 1 pint. Then it is drawn with a single sterile needle that's used only once and then discarded. And every person's body contains about 5 liters or 10.5 pints of blood. Organizations often ask, how do I book a group of appointments? So that's something that I do as a territory manager. So if you're interested in booking a group of 3 or more, I can definitely help you with that. This one comes up quite frequently. How will I feel after donating? Most people feel absolutely great, but there's actually things you can do to help that. So as I mentioned, drinking fluids, eating a salty snack before and after. We want you to avoid strenuous exercise for up to 6 to 8 hours, and don't do any heavy lifting with the arm in which you donated. And believe it or not, this comes up more and more often these days. So the answer is, you won't be able to donate if there's evidence of intoxication or an inability to give informed consent at the time of donation. No alcohol and cannabis or even tobacco is not transfusible through the blood. So that's most of what I wanted to share with you today. I do have a couple closing points. So I'm asking you all for your support. I'm asking you to become part of Canada's Lifeline. You can help us by booking an appointment. If you're unable to donate, you know what? As I mentioned, helping to spread awareness is just as important. We have many events throughout all of Toronto, some of them permanent, like our Yonge and Bloor and Hillcrest locations. And then we also have our mobile donation events, which happen in various community centers, churches, etc. These are some of the ones that are coming up in Scarborough that are currently not booked at 100%. So we really need donors at these events that are coming up. And now I would like to take this opportunity to invite any questions.
And I have a question. I like to travel a lot. So what are the protocol for this travel? And I've been on a lot of cruises, so I go to different countries in any given 3 or 4 weeks.
For sure. So when it comes to travel, typically malaria is the biggest deferrent for travel. So in previous years, if you had visited a malaria risk country, you had to wait a whole year before you could donate again from the date you returned. However, just this past August, we've actually changed our criteria to just 3 months. So if you've visited a certain country, you can actually visit blood.ca. Go under blood and you will see, if you hit travel, a list of all the countries will pop up and it'll show you in red each country, which area of that country is a malaria risk. So certain countries, it's only certain areas and not all. You know, if that's just too complicated, it's as easy as calling 1-888-2-DONATE. Option 5, you can speak with an information nurse and she can answer any and all questions, and she will have all the updated information about our eligibility as well.
Jen, mine's on inventory. Have you ever had a scare where the demand overcomes your supply of blood there? Where you don't have enough donors to handle the necessary needs?
Absolutely, we have that quite often. So we often need a lot of additional donors during holidays and long weekends. So part of that is, it's actually twofold. So the first thing is people are busy. So our regular donors are spending more time with their families. You know, the Christmas is coming up, you know, there's shopping and a non-COVID world. There's a lot more of that. So they may not be booking their regular appointments, or they may not show up for their regular appointments. And then there also tends to be an increase in accidents during holidays. So the need for blood often rises. This year, we're particularly concerned with Christmas week and the week after, and a particular concern is our platelet inventory. Because as I mentioned, platelets only have a shelf life of 7 days. And as of this moment, we're actually, if all of our donations that are scheduled that week don't collect to 100%, there will be a shortage. So our hospitals, we've communicated that with the hospitals so that they know to prioritize need when it comes to blood. One of the things that happens is that they will reschedule non-emergency surgeries, just to ensure that those emergency cases have the blood that they need.
Yeah. Thank you.
No problem.
Jennifer, does
Yes, Basil.
Blood Services pay for blood in the States?
We unfortunately at this time, we only produce approximately 14% of the plasma that we need for patients across Canada. So we do have to import plasma from other areas in order to ensure that the patients that need plasma get the treatment that they need. So we have recently opened 3 plasma centers across Canada, and they just do plasma donations. They don't do regular red blood at all. So we're trying to ensure that we are self-sufficient here in Canada. We don't need to pay extra for the patients across Canada.
Jennifer, is that because our burns typically using plasma?
Absolutely, burn treatments. Yeah, absolutely. Yeah. There's many different diseases and disorders, unfortunately, that use plasma protein products as the treatment. So,
yes.
Right, Danny, you got a question?
Yeah, when I came to Canada, I tried to give blood, and because that was 46 years ago, and because of a childhood illness, I was actually told I had dirty blood. Oh. Yeah, that was my doctor's phrase. I remember it well. So if that happened when I was a child, does that ever expire? Like is there ever a point where you can give blood?
So we're constantly making changes to our eligibility. So we have researchers working around the clock on eligibility, and they work closely with other major blood centers around the world. So, for example, up till 5 years ago, if you had cancer, didn't matter the type of cancer, you just couldn't donate. It was an absolute no. We've evolved that in the last few years, where if you had certain types of cancers, as long as you've been cancer and treatment free for 5 years, you can donate. So we're constantly evolving. My recommendation is call the 1-888 number. Click on option 5 and speak with an information nurse. Perhaps now you can donate.
Okay. Well, I'll do that because I have received blood in an operation, so I would like to donate. Yeah.
For sure. Yeah. Mm-hmm. And as I mentioned, it's just as important to help us spread awareness about the need for blood as it is to donate. We recognize that not everybody can donate. But you could still be part of Canada's Lifeline by just sharing the information, talking to a loved one, a friend, sharing on social media. All these things are so important, and they really make more of an impact than you realize.
Ben? I have a question. Sure. When the expiry of the blood, the life of the blood is expired, then what do you do with that blood? Does it be discarded, or do you have some other use for it?
Well, just so you know, we use all the blood we get. I shouldn't say this, but I'm pretty confident to say that we don't need to discard our blood. So we do have some people who opt in to receive text messages from us. So within a day or two of their donation, they'll get a text message saying the blood is on their way to help a patient in need. Our turnaround time is so quickly. Just to give you a little bit of background, our manufacturing centers in Brampton for this area. So if we have a donation event happening right now, The blood will be picked up at the end of the donation event, sent immediately to Brampton, and it will be processed overnight to be shipped out tomorrow morning to hospitals. So we, across Canada, we have over 720 hospitals that we ship blood to. And in Ontario, we're actually not self-sufficient in our blood. We often need blood transported from other provinces. So we still need so many donors every day. It's just the need really is constant.
Thank you.
Thank you.
And I have a suggestion. If you have any blood over, you could most probably make it into blood pudding. And people like Danny eats a lot of this, so this would go down well. You can make some money with it.
I'll keep that in mind.
Barry, you had a question, didn't you?
Yeah, Jen.
Yes.
Years ago, I had hepatitis as a complication to another infection, and I was told, like Danny, that I couldn't give blood. Is that still a thing?
Do you know which type of hepatitis you had?
The type you don't die from. So I think hepatitis B, I think.
I can tell you if someone else has a question, I can multitask and tell you the answer to that.
Oh, okay.
Does anybody else have a question?
Courtney, you had a question.
Yes, sure. I did have a question. Just going back to the question of eligibility, I know that a few years back there was a very rich and heated conversation with regard to blood donation and the LGBTQ communities.
Mm-hmm.
And so maybe if you can just weigh in a little bit as to where we are with that. I noticed it didn't show up in your list of questionnaires. Second, you moved away from a regular type of bandage to the pressure bandage. Just why?
Sure. So we actually moved away from the pressure bandage because the added pressure actually helps to stop and encourage the clotting process. So we've actually found that since we've moved away from that, we're getting a lot less rebleeds. We did do testing, and we've been working, like I said, with other blood donation organizations around the world. So often when we do implement practices, we're not the first. So, but we do have a very, very strong set of researchers, and then anything we do has to be approved by Health Canada. So we have to provide the evidence, and then they have to approve it before we make changes. So we are going to continue with the pressure bandages because that seems to be the best way for us, and a lot less, like I mentioned, rebleeds. In terms of your second question, we have evolved since. Actually, we're continuing to evolve. So you may or may not know the answer to this, but currently there is a 3-month abstinence requirement for donating blood. Even a few years ago, it was a blanket, you could never. So we've gone from never to 5 years to 1 year to 3 months in a very short amount of time. I understand that might not be an acceptable answer for everybody, but please know we're working very closely with our counterparts around the world to move to a behavioral type question, which would be more on par with everybody else. So we're almost there. We're getting there. We're getting the research ready to provide to Health Canada to show that we can evolve this even further. Yes, I hope that answers your question.
Okay.
Okay. So for hepatitis, so you may be able to donate with a history of jaundice or hepatitis 6 months after you've fully recovered, unless the cause was due to hepatitis B. If you've ever tested
mine was
positive,
hepatitis B.
Pardon me?
I believe I was hepatitis B.
Yeah, so if you tested positive for hepatitis B or C, you are not eligible to donate. Could this be something that eventually we evolve? I don't know, but like I said, we're trying to make our eligibility as inclusive as possible, and we are working constantly on all the different things which, are add the most constraints to our inventory.
Okay.
I noticed that, for example, I couldn't give blood because I lived in the early 80s in Germany. It's amazing. It seems that such a long time ago, and wow. Anyway, and I gave blood in Germany. You may find this interesting. As a student, we would get $50. That was great. We gave blood all the time, as much as we could.
Absolutely, I can imagine, especially as a student back then, that would seem like a great amount of money. I was actually speaking, I have some really great contacts at General Motors in Oshawa, and their management allows their employees to take paid time off during the day to go donate blood. So we have really great support. So all the little things count, right?
Yeah, no, for sure. I can't remember how many beers $50 was, but it was a lot of beer. 100 beers or something.
I've tried to get some of the local breweries to do a pint for pint promotion, where if people donate a pint of blood, because that is essentially how much you donate, then you get a coupon for a pint of beer. So yeah, it's just something I've worked on a few times, especially around the schools, the post-secondary schools.
That's to a gallon I may be in.
Yeah.
Okay, I don't think we have any more questions. Thank you, Jennifer. That was a great presentation. Thank you, Amy.
Oh, very much. Thank you, Jennifer.
Would you like to formally thank Jennifer, please?
Jennifer, this is very dear to my heart, the giving of blood. I was always a donor. And when I was 48 years old, I'd never been in hospital, or at least had anesthetic, but I had a multi-trauma accident. So I'm one of your 50 people.
Wow.
And I'm saying it was amazing. They were putting blood in faster, or I was losing it faster than they were putting it in. So that was my first experience with the hospital and the amount of time that I was in there. The second thing, if I roll forward to now, my best buddy, who we were born in the same street. We grew up together. We worked in the same company together. We came to Canada together. Just a year ago, he was diagnosed with leukemia. And he was 1 year. He's just home now. He's been home about a month. He was 11 months getting nothing but blood transfusions and that, So this is very dear to my heart. This was very enlightening and very informative what you gave us today. And I can see it's in good hands, that and it's an ever-ending battle, I'm sure, But it was a wonderful presentation. Thank you very much for delivering it the way you did. And Amy, good luck in your new position. And let's see if we can give some blood, guys and gals.
Yeah.
Thank you very much.
Thank you. Thank you. So I just want to say thank you to Gord and everybody for allowing us in on your meeting. It was a great meeting. I really enjoyed all the questions from all of you. It was lovely to meet you over the internet, and hopefully we can do this again one day soon, or maybe we can meet in person one day.
Thank you.
Thank you.
Everybody.